for Family Health. We have Support Services Manager Nimtz and Behavioral Health Consultant Kaitlyn Wixom. Welcome to the show.
Good morning.
Good morning.
Nate's been on our afternoon show a few times.
A few times, yep.
Yeah. Early in the COVID. You guys talked about leadership during the pandemic, and Center for Family Health certainly providing that. Now we're kind of doing the cleanup.
Yeah, absolutely.
We've got, mental health issues and behavioral health. So let's find out first. Kaitlyn, tell us a little bit about yourself and what you do at CFH.
So I'm one of the behavioral health consultants, a fancy word for a therapist. I do therapy about half the time, and then I do health coaching half the time. So I'm working very closely with our providers, our nurses, even the MAs to provide support to patients during their visits. And I do see some of those patients ongoing for therapy. I work very closely with our medically assisted treatment program as a substance use therapist. I do both individual and group therapy for that.
Nate, how about you? Same question.
Yeah, I am the support services manager at the center. So I oversee and support our behavioral health consultants, our community health worker team, and our dietitian and nutrition programs.
Oh. What is behavioral health, or what are some behavioral health issues?
Yeah, absolutely. So this is actually something we've talked about frequently, the difference between behavioral health and mental health, right? So behavioral health in general is, I would say, we see a lot of anxiety, we see a lot of depression, but it's even more than that. It's a behavior change aspect. Katie, do you have anything to input there?
I think behavioral health encompasses a lot more than mental health in the aspect that it doesn't have to just be about being depressed or being anxious. This can be, I'm ready to make a life change. I don't know the steps to get there, or it's stressful coping with this, but I'm ready to do it. And that's kind of where we step in and help with that change.
Yeah, everyone has issues and stresses. What about folks who have, maybe their jobs have changed over the last 2 years, they were out and about, and then work from home for 2.5 years? Are you guys seeing people that really are just now getting back out into society?
I'm seeing a lot of social anxiety with that because people were isolated for so long, they almost forgot how to interact with other people. And I get that it's scary, it's a lot of change, any change is scary, but a lot of people don't know how to cope with that stress. And I think the basis with any change or any mental health or behavioral health issue is being able to cope. And that's, again, something that we really stress.
You guys offer groups, and you offer that support.
Absolutely, yeah. So we offer several different groups. We offer, of course, we have our dietitian groups and whatnot. And then we also have an anxiety and depression support group. And that is led by one of our therapists, but it's also peer support as well. So it gives the opportunity for patients to really rely on each other and get to know each other. And then Katie, you can speak about your group a little bit.
I run our substance use group. It's a recovery skills workshop. It's very much for support. We have people who are very new in their recovery, and then we have people who have maintained for many years. Typically, these people are part of our medically assisted treatment program, which consists of Suboxone and Vivitrol, which helps people not relapse. Like I said, a lot of support. It's, can you cope with this? Scheduling is easy, something that seems to us, it's something new to these this population, these people that haven't done that. So a lot of different skills.
And then our newest group at the center is our True Colors support group, and it's actually a support group for LGBTQ youth, ages 13 to 19. So that's something that we just started not too long ago.
Are these groups for people who have seen and had treatment by a provider, and then they're funneled into a group, or can people just get into a group without having a diagnosis?
Yeah, so our groups are open to all of our patients at the center. And yeah, they're pretty much self-referral for the most part.
Are there differences on how adults are treated versus how children are treated for anxiety, depression?
Absolutely. Yeah, Katie, I'll let you take that question.
Yeah, so the approach is typically very different. How you talk to a kid can be a lot different than how you talk to an adult. Kids are playing a lot of games to learn skills. So maybe Uno with each card meaning a different thing. So anger, happiness, how do you cope with that? What does that look like? Where adults is more talk therapy based, but the end goal is learning to cope.
I guess things like overeating, alcohol abuse, substance abuse, all those fall into behavioral health too.
Absolutely.
How about, you're seeing new anger issues maybe from children, that type of thing?
Mm-hmm.
Yep, absolutely. So again, these are responses to change or stressors in lives of both children and adults. So learning to cope with that is the kind of the basis of anything. Can you cope with this change? Just anger's something that comes up because we're feeling something else. So can we find that underlying cause and cope with that? Substance use, again, typically people are trying to cope. I'm going to go have a drink because I'm stressed. Okay, let's cope with that stress so we're not turning to the substance.
People are typically hesitant to admit issues like that. When they do finally, have they reached a point where it's, like too late? They've got too many issues.
I mean, I'd say it's never too late, right? Like, and we definitely try to, at the center at least, we have a full team of people that are there ready to support you. It's just, sometimes it's just a matter of asking for help, which is definitely the hardest,
Yeah. Some people have to be, they have to have an intervention before they realize that they are really in deep trouble.
Yeah.
People are, they're typically afraid. So, what's the first step? How does someone make that call? Or what do they say when they come in?
So sometimes the doctors or even MAs will notice something during a visit, which is where the health coaching comes in. They might notice a patient's stress or they scored a little high on one of their screeners and they give us a call. We step in and just chat with them. Hey, how's it going? What's going on? What kind of stuff's stressing you out? What can we do to help?
Yeah, just to piggyback off of what Katie said, we are an integrated health clinic, so all of our doctors, our nurses, our MAs are all trained, have significant training in mental health as well, so they're all able to sort of catch those things. Because early interventions are super important. So
It seems like we get that question at every doctor visit: is do you feel safe at home? Have you been depressed? Have you ever thought about doing harm to yourself?
Yep.
It's just standard protocol.
Yeah, as it should be. Absolutely.
But a lot of people probably fill out that sheet and they're lying.
Right. They just fill it out because they got to fill it out again.
Yeah, exactly.
And everyone gets those questions. It's not because someone smells like gin. It's because everyone has to go through the screening.
Right.
Absolutely.
How has COVID-19 increased risks for excessive alcohol and substance abuse? Is it the isolation?
It's the isolation, the stress. A lot of people faced financial barriers, childcare barriers. Okay, school's closed for a week, figure it out. So there's a lot of barriers there that have come up as a result of COVID. Again, the stress, the isolation, turning to whatever they can to cope.
Yeah, we've got, I think people for the very first time are realizing they can't handle it by themselves. And do you think the pandemic has caused more of this?
Yeah, I would say so, absolutely.
Who's doing better, kids or adults?
Oh, who's doing better?
I think adults have more of an ability to cope than kids do.
Sure.
Kids learn from their parents. Kids learn from those around them. Typically, kids are more resilient because they aren't as focused on all of the stressors. But I think the adults have the better ability to cope.
See, you thought it was the opposite, didn't you?
I think sometimes adults use the excuse that, their kids are having a hard time because of it. But, there's some kids have been in school the whole time, some haven't. So again, everyone's different for sure.
Yeah, and I guess it depends on what you're exposed to as a kid. Some people, their kids are watching, all the news, the Ukraine. What's the impact of all that.
Yeah, what's on TV at your house?
Yeah.
That can make a big difference as well.
Or just keep it on JTV. That's our suggestion.
Problem solved, right?
Yeah, there you go.
And we appreciate that. We know people that do just allow their kids to watch JTV.
It's very good.
Nate Nimtz and Kaitlyn Wixom are with us from the Center for Family Health. More with these two after this.
On May 3rd, the voters of Western School District will consider a ballot proposal to build a new state-of-the-art elementary school at a zero increase to the current millage rate. This is an incredible opportunity to ensure success for our students and community well into the future. As a proud Panther, I urge you to vote yes on Tuesday, May 3rd. It's time we come together for our kids and community. Go Panthers!
With proper alignment, your vehicle's tires can last a lot longer. At G-Force Automotive, we perform a comprehensive front-end inspection and perform a complete alignment on your car, truck, or SUV. We'll keep you driving straight down the road. At G-Force Automotive, we make friends one car repair at a time.
Registration is now open for Jackson YMCA Summer Day Camp. The camp is about learning skills, developing character, and making friends. Every new experience at day camp is a chance for kids to stay active, address gaps in learning when school's not in session, and have fun. Open to ages 4 to 14. Sign up for just 1 week or all 10 at jacksonymca.org.
We at the Cascade Humane Society are dedicated in our mission of connecting animals in need with people who care. We vaccinate, spay or neuter, and disease test all cats and dogs that come through our doors. We have limited intake, but we never limit the time a pet can stay with us. Our low-cost spay and neuter program keeps unwanted puppies and kittens to a minimum and out of our shelter. As a nonprofit, we are always in need of both monetary and pet-related donations. Visit us at the Cascade Humane Society, and you might just find your next best friend.
Welcome back to the morning show on JTV. We have a dog-friendly event coming up. It's the Bark and Brew presented by TAC, and it's happening Saturday, May 21st at Keeley Park. From 1 to 6 p.m., enjoy craft beers from local brewers, great food, live entertainment, and a dog talent show. Proceeds benefit the Jackson County Animal Shelter Community Spay and Neuter Program and Emergency Service for JCS Animals. Tickets on sale now, or you can just show up and pay when you get there.
Nate and Kate are with us from the Center for Family Health. People call you Kate?
Yeah.
We're talking about behavioral health, mental health. With the increase that you've noted during the pandemic, have you had to adjust how you deliver the services, add more people or more services?
Yeah, we're always expanding and always growing. So I don't know if I'd say that was specifically from the pandemic, but we have added some new services. Our classes and groups a lot of our classes and groups were in response to the pandemic, and then allowing it on Zoom was also part of that as well. So
People got zoomed out, I think.
I did.
I know.
I did. It felt like schoolwork.
Yeah.
Every time I logged into Zoom.
Yeah. Now, with this, everyone's having a bad day at some point.
Mm-hmm.
How do you know that it's more than just a bad day, and that you should seek some sort of help?
Absolutely.
I think when it becomes a regular thing. So
Becomes a bad month.
yeah,
Yeah.
a bad day turns into a bad week, turns into a bad month, and you're constantly feeling down or anxious or stressed, and you just can't pull yourself out of that.
What are some practical steps that we can just take to help improve our mental health?
So this is one of my favorites to talk about. So self-care is huge. Doing something for you that really makes you feel good. So that can be a hobby, maybe that's spending time with friends and family or having a game night. Some families do like a Sunday family dinner, and that's their quality time, their self-care. That looks different for everybody. There's no wrong answer, but really making sure that you're taking care of you.
Like rewards. What do you think about rewards if you get through? Maybe it's alcohol. You don't drink for the day. Do you like the rewards system?
Absolutely. I mean, this works from kids all the way up through adults. So maybe it's not drinking, maybe it's weight loss, whatever it is, rewarding yourself for every little accomplishment that you're getting. If I can make it through the day without a drink, okay, what am I going to do for myself? And then it builds those good habits.
It's starting small with those goals too, right? Because if you just set yourself a goal and it's this big lofty goal, you're never going to reach it. So taking steps to reach that goal.
What does it cost to come see you guys?
Yeah, so we have a lot of different programs available to help with the cost. So we have financial service advocates right in our building that are able to help you get signed up for whether it's health insurance or some sort of health coverage, and then we do also have a sliding fee discount program as well. So honestly, I always say, you're never going to be turned away for an inability to pay, so there's lots of options.
And anyone can be a patient.
Absolutely, yeah, absolutely.
This is National Minority Health Awareness Month, and the center has been stressing all month that minorities, they've been traditionally getting the short end of the deal when it comes to healthcare.
Absolutely, yeah, and we have, like I said, we have a lot of people available there to help you out, and a lot of people on board with that. So.
And I think that's part of kind of what the center stands for, is really opening that door to healthcare for everybody.
Right.
So whether it's you come in through our walk-in and you need services right then to get established to help you because you're struggling then and you need help now, but really anybody that needs help, we're there to serve.
What do people do to contact the center? Do they need any kind of referral or anything?
Absolutely not. Just give us a call, 748-5500, or of course visit our website, centerforfamilyhealth.org.
Any advice for parents with kids that are maybe not acting themselves lately?
I would say reach out for help.
Mm-hmm.
I mean, that's kind of one of the biggest things there. Reach out if you need help. You identify that you need help. Your kiddo needs help. Reach out. We're here. So.
I think some people I've noticed, because they've been away from the doctor for a couple of years, that they're having a hard time getting in, particularly to specialists. I know
That's
someone
true.
couldn't get in until September for
Mm-hmm.
something. It's crazy, but how about you guys? Are you able to get people in pretty quick?
We are. And then we always have our walk-in clinic available as well, for those sorts of things. That's open Monday through Friday, 8 to 9 or 9 to 9, and then the weekends 9 to 6.
Still doing the shots?
We
COVID
are,
shots?
yes, COVID vaccines, and we're still doing a little bit of COVID. I mean, we're doing COVID testing. We're not doing a lot of tests, but
Have you seen it drop off in both cases?
yes, yeah, we're still doing vaccines, so, which is great. Still doing lots of boosters.
Are you guys doing a lot of vaccines for people just kind of coming in on their
Yeah.
other visits and things
Yep,
like that,
yeah,
asking them?
yeah. We've integrated that now as just like we would any other vaccine.
Nice.
You come in for your physical, and hey, do you want your COVID vaccine over here? We've been doing that for a while.
I think we're at a point where it's the matter of convenience when someone gets the
probably.
booster. It's like, well,
So, yeah.
I'll get around to it.
I think
Yeah.
I think the same thing with the booster too. Yeah,
Yeah.
you're exactly right.
Great to see you both. Thanks for coming in
Yeah,
today.
thank you.
Nate Nimtz is Support Services Manager, and Kaitlyn Wixom is Behavioral Health Consultant at the Center for Family Health. We've got some soccer stars and coaches